Okay, so before I get started, please allow me to introduce our speaker for today. Today we have two beautiful ladies from Regen, Physio and Sports Rehab. They are Chloe Lim and Thulasi. Chloe is a senior physiotherapist with 4 years of experience diagnosing and treating musculoskeletal conditions. She values the importance of movement and therefore strives to empower her patients through active rehab. She believes that no matter what your activity preferences are, be it lifting, conditioning, or flow-based movement like yoga, or if you live a sedentary life, there is always something for everyone when it comes to tailoring physio work relevant to your needs and interests. P.S. Chloe plays tennis. Thulasi is a physiotherapist with 3+ years of experience in the industry. She has a keen interest in scoliosis, postural-related issues, and most musculoskeletal based conditions. Together with her experience using the Stroth method for scoliosis, Thulasi enjoys exploring movements and using movement-based rehab such as Pilates and exercise to incorporate into the patient's rehab plan. Fun fact, Thulasi is a huge football fan. This is interesting. Okay, and for those who are seeing me for the first time, my name is Amy. I'm your moderator for today. So without further delay, I would like to invite Chloe and Thulasi to take over for today's session. Thank you.
Thank you, Amy. Thank you, Amy. So as Amy introduced us, we are from Regen, Physio and Sports Rehab. And today we will be looking into some of the more common aches and pains that are experienced by the general office workforce or those who work at desks for prolonged hours with their electronic device. And so we've been moving on from work from home back to the office. But a lot of you may notice that, hey, despite moving back to the office, I'm still having persistent neck aches, back aches, headaches, and some of you even numbness in the hands. And you'll be questioning, okay, is that my work setup? But how come I'm moving back to a better place and yet still having these symptoms? So we are here to share with you from our point of view as physiotherapists, what goes on our heads clinically, the thought process that goes through our minds when we see someone experiencing these symptoms when they come in to see physio for their common aches and discomfort. And throughout the talk, there will be opportunities for you to explore your body and understand how the mechanisms behind why you get these aches. And hopefully through that, you'll be able to understand and make adjustments to your work, as well as seek help when necessary. So we're going to get started with, from the top, headaches. Okay, let's slide. Yeah. All right. Headaches. So where we come from seeing headaches is an irritation to any structures in the upper cervical spine. So our spine, the neck here is called the cervical spine, and any structure irritation from the C1, 2, 3, when it's irritated, it can refer pain to the head. So any structures such as ligaments, discs, nerves, or even the muscle points, the muscle attachments onto the scalp. So as you can see in this video here, there are the purple color lines. So that is the nerve. They exit from the upper cervical tract here and they can supply your head. So irritation to any of these things around that nerves can give you pain in the head. And besides nerves, we also see that there are some muscles that attach onto the head, onto the neck, that can refer pain. So these are called trigger points. And different muscles can refer to different areas of the head and different pains to the head. So for example, let's take the top right corner. That's called your suboccipital muscles. They are the tiny muscles at the base of your scalp. If you put your hand underneath your head here, just right there, this area here is your suboccipitals. And those muscles, when they are irritated, they can refer to pain around here. Likewise, if you look at the lower left corner, that's one of your neck muscles. They also refer to the pain at the top of your head. My favorite one is the SCM, which is this muscle here. And that one refers to pain around the eyes. So we've talked about muscles, we've talked about nerves. Now I want to bring your attention to consider another thing that can cause headache. Screen time for working adults plays a huge role in headaches, but we always neglect the one structure that is responsible for that screen time. Now, if you're in a chat, type down what body part do you think, besides the neck that I just talked about, what do you think causes headaches purely from screen time? what structure, the body part is actually responsible when you're looking at the screen. Back. Okay, someone said back. Anything else? Headaches, we're talking about headaches and we are relating it to looking at the screen. Now I'm looking at my computer screen. Now we see some answers closer to what we're expecting. That's right, guys, it's your eyes. Your eyes are doing the looking at your screen. So this is a very undermined suspect. No one thinks it comes from the eyes. So here, I'm going to highlight to you the relationship between your eyes and your neck. So up in our cervical spine here, the upper segment here, there is a lot of receptors or sensors. These are called mechanoreceptors. Don't worry about the big words. All you need to know is they are sensing, they are sensors, and they give us feedback to where our body is in space, where our head orientation is, and where our eye movements control come from. So remember earlier on, I was saying about irritations to this structure can cause headaches. Irritation to this structure can also impair the movements and the control of your eyes. And we want to show you how the eye and the neck is connected. We're going to do a little bit of a practical now. So you can place your hands just like how that man is placing his hand on his head, either with your thumb cupped around the base of your skull, or you can do it like a neck collar position with your fingers, your index, middle, or your fourth finger clasped around here, right under the base of your skull, right there. Now you don't have to exert a lot of pressure. It is just as a feeler. Okay, your fingers are sensitive. I just want you to place your hands there. Now my instruction is, without moving your head, we're going to get you to move your eyes. So I'm going to have my hands here, feeling the base of your neck. You're going to look up without moving your head. And you're going to look down without moving your head. Same thing, you can do it with your eyes closed also. Close your eyes and look up and look down. You can try looking left, looking right. I want you to have a feel of what is going on under your fingertips. Some of you may feel that, oh, when I look up, I can feel these minuscule twitches under my finger. Some of you may not feel anything. Some of you may feel, if I look up, I feel something. If I look down, I don't feel anything. If I turn my eyes to the left, I feel something on my left. If I turn my eyes to the right, I feel something. So I just want you to appreciate all these feelings that you're getting under your fingers, under your thumbs, because these are your small suboccipital muscles that are contracting as you move your eyes. Now, you're not even moving your neck, you're just moving your eyes. So this is how we're going to highlight to you the subtlety of the movement from your eyes can affect how these small neck muscles are working. So take note of how effortful it is to go to different corners. Take note of how easy it is to move your eyes up and down, and take note of how much pressure you're feeling with the contraction of that little tiny suboccipital muscles, because this is where it's going to be important. Now you say, Chloe, first you say neck caused me headache. Then you say eye is related to the neck. So which of it is causing my headache? The eyes or the neck? Here is where it's a chicken and egg discussion. When both your senses or one of your senses are faulty, that's when you're going to have referred pain to the head. So the first box that you see there, are there corners of your eyes that you can't quite get to? Do you have angles or directions when you try and move your eyes, when you try and turn left and right, that you find it a little bit more effortful? So if your eyes aren't working properly, this is a visual sense, talking about the eyes right now, and your movement gaze is only to a certain direction, that's going to affect how much movement the neck is going to be able to do. Okay, so if your eyes is only fixated within this 13 inch of the screen, your neck muscle isn't going to be able to expand and explore beyond that boundary. And then we move on to the next scenario, which is more relevant for a lot of you, sitting at your desk for prolonged periods of time. You've heard of the term use it or lose it. Same goes with any muscle, including the neck. When you're not utilizing your neck muscles from your eyes, it's a bit confusing, You're not looking at the other places of your office, you're just fixated at your screen. Those neck muscles are only going to work within that boundary. So they're not going to be used in turning all the way there, So you're underutilizing the neck muscles and they're not going to get the stimulation that's going to give you feedback to the body to tell you where your head is in space. So some people, you may notice their head tilts this way and they think they're straight. It's called this thing. Or some people have their head this way and they say, yeah, no, I'm walking around like that. It is my midline. But no, it's likely because their eyes aren't in that visual field. The neck is fixated in a certain degree, don't get that stimulation and holds tension there. Then now you ask, why am I getting headaches? If your neck is constantly held here, some muscles are working very, very hard to keep it in a non-neutral position. That's when it's going to refer to irritation around here, irritation up to the head, giving you headaches. And lastly, maybe you just have weaker neck muscles or poor control and poor activation, and that's restricting your eye movement. So maybe it's not a problem with your eye. Maybe it's a problem with your neck, that your neck can't control the region of where the eyes can go. So it is our job to find out, okay, do you have an eye problem or neck problem? Tired eyes can mean tired neck. Same thing, a tired neck can cause your eyes to strain. So some people have headache because eyes focus very hard, but the problem might be coming from your neck. So after knowing all this, what can you do to help yourself? The first column is something that everyone always tells you to do. Take breaks. Don't stay in position for too long. Turn, get up and move. Sounds like simple advice, right? But after knowing the connection between your head and neck, I hope that you can understand why this advice is relevant. Because if you're staring at your screen for too long and you're not looking around or getting up and move, you're not going to get the stimulation and therefore causing you to get headaches indirectly. But if you say, I always do this, I take breaks every half an hour, why do I still have this issue? That's when you want to come and see a physiotherapist to get yourself checked to see if it's an eye problem or neck problem. And here's what physios can do for you. We'll give you eyes training or neck training, depending on what we find. Gaze stabilization. Some people just have poorer control towards certain angles. A lot of people think that, oh, physios deal with muscle. But actually, we deal with the finer intricacies of even controlling your eye movements that is very subtle to causing your headaches. The third point is where most people like release tension in the neck. Massage. So physios can help you massage the relevant muscles in your neck. So you think, okay, I'll go to a masseuse, simple. But you want to be massaging or releasing the muscles that are overworking. But then are those muscles overworking because they are weak and they are not strong enough, therefore a little bit of pressure causes them pain? Or are those muscles overworking because something else is not working? So here is where you want to train up the weak muscles, be it the actual neck muscles or the muscles that the neck is actually supporting, i.e. your shoulder, i.e. your back muscles. And here is where Thulasi is going to come in to talk about the relationship between your neck and your shoulder.
All right, so now I have a question for the floor. Do you think your pain source, let's say we have a neck, shoulder, so this particular region here. So when you have a pain, do you think it's coming from a very stiff neck, or do you think it's coming from a shoulder? Is the issue that causing that pain is a neck joint or muscle, or is it coming from a shoulder pathology? So you guys can type in the chat, let us know what you think. And then after that, we will dive a little bit deep into it. Somebody said neck. Shoulder. Okay. Most of y'all say it's coming from a neck. And then there's like some of y'all who think it's a shoulder. Actually, it's a trick question. Because, fun fact, if you did not know, your neck and your shoulders actually do share the same muscles, tendons, and ligaments. So the potential irritation or the injury from the neck itself could potentially cause referred pain down your shoulders, vice versa. A shoulder injury could cause some sort of neck tension, or it can cause some sort of pain or irritation on the neck itself. So that's why I say it's a trick question. So it could be either one. And why do you think it's neck pain, but I get it down the shoulder, or shoulder pain, why do I get it into the neck? So now we're gonna dive a little bit into an anatomy app, because we wanna show you how muscles intertwine and how they sit on our bodies. Okay, so this is our anatomy app, okay? So we're gonna look into your neck. So let me put a few layers of muscles. So as you can see, the neck actually holds quite a lot of muscle. So this is the most common problems that people always complain about. Pain all the way from the neck, all the way to the shoulder. So as you guys can see, it attaches to the base of your skull and all the way to the tip of your shoulder, which means any end of the muscle could be the problematic, but the entire muscle will then give you some sort of pain and sore kind of sensation. If I were to take this off, most of the muscles you can see that they all insert at the base of your neck. It goes down to the lower spine, or it goes down to the shoulder blades itself. So that's why sometimes after sitting too long, after being on your device for too long, you do tend to have aches coming from, oh, my shoulder blade aches. Oh, sometimes my hand, I can't lift up, it feels a bit more tired. Or sometimes it's just my neck. I do this, but I feel it more here rather than the neck. These are the reasons why you feel it on both sides. So now we're going to go back to our slides. Okay, so these are some of the common symptoms that we actually hear on our day-to-day with patients and stuff. Pain worsens at the end of the day. So that means, let's say they have been working 8 to 5 jobs. So their pains don't kick in until when they're about like 3, 4 in the evening. They start feeling a bit more sore. It's not painful. They can still bear with it. They can still do their work. But by the end of the day, when they're back, it's very painful. Or certain angles are a bit more achy. That means they can look straight ahead, they are fine. But when they drive and they have to turn to look at their side mirrors, then they feel, my neck feels a bit more tighter, but at the front, they are fine. Same goes to some people will complain that it's pain down their shoulder blades after a long day of looking into the screen this way or just typing in general. So my question to you guys again, is it coming from a shoulder or is it coming from within your neck itself? So let me continue. How do you know which is which? A muscular cause, a muscular pathology usually presents at the end of the day. That means you put a structure through a tension load. That means 8 to 5. You put a structure on tension load, you don't feel it throughout the day, but you feel it at the end of the day when the muscle hits its capacity. While joint itself, usually joint feels like, it feels very stiff, but if I try a few more times, I will be able to move. That's usually joint. Same goes to shoulders. Some people will not be able to lift up their shoulders, but after attempting a few times, then they will feel like, I can move a bit better now. So that's how you differentiate between muscles and joint itself. So I'm going to give you guys a little bit of deeper insight between joint and muscle. What is the difference between these two? So let's look into pathology of joint first. Okay, joint can be two things. It's either your joint is very stiff, so some segments don't move, which clinically we call it hypermobile. So that means movement of the joint itself is limited or difficult, and it causes you to reduce your range of motion. So that means you will not be able to turn as far, or you will not be able to look up or down as much. So you feel like something is just not letting go. Or it could be an instability. That means some parts of your joint works on perfect range and the others, they work a little bit more too much. So this could come from, let's say you are a very flexible person, so you generally do have a little bit more range in your joint. Or it could come from something is stuck, therefore the segment at the below has to move a little bit more. That could also cause you pain. So I'm going to show you guys how a normal joint of the neck itself is supposed to look like. So this is how a cervical joint is supposed to look like. The one on the right hand side where the green line is, that's how your curvature of your neck is supposed to be. So it is a bit more tilted and you can see like a partial C shape. So that means every joint moves in different segments rather than being just a straight neck. While you can look at the left side, where you can see the neck is relatively a bit more straighter. Actually, this is most of our necks because we do have a tendency of, we don't have that curvature. We do have this sort of movement because we are always on a computer, on a screen, on a phone. So we do have a more protruded neck. So as you can see on the left-hand side, the space in between the joints, it's reduced. And you can see that there will be joint on joint irritation. So that means your joint on joint literally sits on top like that and it causes some sort of irritation. So these are all potentials of why your neck muscle is working too much, or why do you have pain? Okay, so now we're gonna try something out, okay? I want you guys to stay in your current posture, okay? Don't correct your posture. All I want you guys to do is chin up, look into the ceiling, look all the way up, and come back down. Okay, feel for that movement, see how you feel. Is it harder for you to look up, or do you feel some sort of restriction at the back of your neck? Is there a tightness that you're feeling? You guys can type it at the chat so we know what you guys are actually feeling. Okay, someone said tightness at the back of the neck. So that means when you look up, you feel a bit more tighter. Anything else? Okay, someone said it feels normal. That's good actually. No restrictions, but feel pain on the left arm. Okay, interesting. Same tightness at the bottom. Okay, so most of the people feel tightness at the base of the movement. And those who say normal, congrats, you guys have pretty good joint. Okay, the tightness at the bottom. So what I want you guys to feel is, I want you guys to feel, draw your shoulders slightly backwards. So that means you have a bit more chest out kind of position. From there, now try to look up. Does the movement get easier? Does it change your symptoms? Yeah, a shoulder retraction. Just a slight shoulder retraction and look up. Do you feel like your muscles tend to be a bit more looser, so you get to see a bit more clearer and a bit more easier way? Yeah, so that's, yes, muscle ache reduce. Yeah, so that's just how our posture is. Remember the slide that I showed you? So this particular one. So all we did was we modified the way your neck is. We modified the way how your joint looks like. So we gave you a little bit of retraction. We opened up your chest to allow a bit more range in your joint itself. That's why it feels less painful, less achy. Okay, so for those who said that they had muscle pain, both side tightness, and then they feel more muscular ache, let's talk about pathologies of muscle. Okay, I always tell my patients when they come in, because something is working very hard and something is not moving very well, that's why something is working very hard. So muscles, usually it could be two different things. It's either your muscles are underworking, meaning they are weak, they cannot perform at their potential capacity, or they are overworking. Usually underworking happens post-injury, post-spasm. So let's say you got an injury, a sudden turn, a sudden strain on your neck. So muscles tend to underwork in order to protect themselves, while overworking is usually to compensate for something that you're not doing. Okay, let's say your neck joint itself, the joint is not moving and shearing how it's supposed to be. Then muscles will take over and overwork in order for you to be able to still achieve the movement, but coming from a more muscular presentation. So hence why you can still move throughout the day while you're working and stuff, but at the end of the day, muscle gets tired because they're working and they're doing too much of work, and you start having all this soreness and pain and whatnot. So that's why muscle imbalances can lead to muscle on one side of the joint becoming chronically shortened and muscles on the opposite joint becoming chronically lengthened. What it means is, usually when you have muscle imbalances, when you sit straight and you look into the mirror, you will be able to see that distance from your shoulder to your neck on one side will be a bit more shorter, while the distance between the neck and the shoulder on the other side will look a bit more lengthened. It's usually one side is working too hard and one side is not working very well. So one side becomes a bit more shortened and one side becomes a bit more lengthened. Which we usually have to check it out to see how it's working and what is constricting the movement itself. So now for a muscle kind of sensation, I'm going to teach you how to feel for your muscles, okay? So all we're going to do, hey, I want you guys to tilt your head. So bring your ears to your shoulder, keep it there. From there, I want you guys to turn up, look into your right shoulder. You should be able to feel some sort of muscle tension. You can try both sides. One side is usually more restricted compared to the other side? Let us know if you guys can actually feel it. So the one that you guys are feeling, that achiness, that's usually coming from a more muscular imbalances. Most of us, we are one-sided dominant. So we do tend to use one side more than the other side. Hence, the other side gets a bit more left out. It doesn't do as much of work as the other side is doing. Or it could be coming from a work ergonomics, like how Chloe spoke. So imagine ergonomics. Some people have triple screen. So they have a 180 degrees view of their screen. So they tend to turn a bit more left and right throughout the day. But some, they have that one screen. And usually that screen is not in the middle. It's more angled to one side. So mostly it's on the right side because your mouse is on the right side and whatnot. So imagine when you sit throughout the day, you keep turning and looking into that right corner. And you very rarely turn and look into the left corner, which means the left muscles become a bit more tighter, a bit more shortened. Hence, when you turn, it feels like something doesn't feel right compared to the left and right. So that's how muscular structures work. So hope you guys understood that. So now I'm going to pass the floor to Chloe to give you guys what else, other than joints and muscles, what else can cause neck pain or shoulder pain or headaches.
Okay, so actually the next segment, I'm going to be talking a bit more about numbness, but you will see how it relates to the head, the neck and the shoulder, tying into Thulasi's slides as well. So first things first, you need to understand with nerve symptoms, they are very specific. When your nerve is irritated, these are the few signs that you can know that it is the nerve symptoms. Numbness or pins and needles would be one of them. Sharp shooting pain, so almost like electric shock-like pain, burning sensation, and in the worst case scenario, the loss of strength. So nerves, I like to think about them as roads and highways. So you leave your house, you go onto your Taman Road, you go into a highway, go down PJ, or travel to Seremban, whatever. Same thing like nerve, it exits from a point of the neck, it branches out into different cabang, different areas, different avenues, supplying to different regions of different skin, different muscle groups. So nerves, as you can see in that little box there, it's a widespread network of connection. And at any point of that connection, just like your roads, there can be a roadblock. Obstructions can occur, and these obstructions are known as nerve entrapments. Another theory that you need to understand is that nerve has the ability to slide and glide. Okay, so slide and glide is the ability of the nerve to move smoothly through the entire path. So when I move my hand like this, the nerve should be able to floss and follow the pathway, just like how cars follow through the tunnels, go through different places. But what happens is when there is an entrapment somewhere and you have a roadblock there right at my elbow, and when I'm trying to move, suddenly this nerve becomes a bit more tension. It restricts the mobility of the nerve. This one roadblock here can cause restriction of the nerve downwards or upwards. And this is known as a high nerve tension. So when your nerve is irritated, when there is a high nerve tension, what did I say earlier about the signs and symptoms of nerve? You may end up with numbness on your hands. So numbness on your hands here, or numbness up in the shoulder. That's why shoulder pain feels a bit weird achiness can be coming from a nerve entrapment. Now I'm going to bring you into the anatomy app again to explore, the nervous system. So here's my friend here. This is called the brachial plexus. Okay, this one here. Now, like I said, the nerve exits from the root right there. So different levels of the spine, the different cervical spine correspond with different nerve roots that comes out from the different levels. And then they form the spinal nerves that carries on going down And if you trace and trace, it's going to end up going down all the way into the hand, depending on where you go lah. So here is the main nerve branch. And from that nerve branch, it splits into different connections. So let's take this, for example. This is your radial nerve. This nerve, if you follow it down, goes all the way to the thumb. So we're going to isolate this section. That. And there, it goes all the way to the thumb. So if you have an entrapment site somewhere, say in the elbow, that's not your elbow, but say that was the elbow, you can have symptoms down here, or you can have symptoms further up the line into the shoulder where the nerve comes from. So likewise, that was just one nerve. Another nerve would be, let's say, take this one. That goes down into your hand. So the median nerve, this is responsible for carpal tunnel syndrome. It starts near the armpit there, goes down and supplies the hand and all the fingers in your palms. So again, like I said, if you have a roadblock from here, you may end up having problems right there. And that's where you get your numbness in your hands. So sometimes people think numbness and then they rub their hands, they try to massage, but probably the pain source and the numbness source isn't even coming from the hand. It's coming from up the chain from the nerve itself. So if you think that bones itself is complicated, let's add on even more structures and layers. This is without any obstruction. Now, if we add on muscles, look how much the nerve has got to go through and go in between before it can reach the hand. So there are lots of entrapment sites. There are lots of room for roadblocks. You can have a roadblock here, in between your muscles, between this muscle, between this bone and between this muscle. So at different parts of the shoulder, the neck, you can have an entrapment site giving you numbness into the hands. So like I said earlier, a pain source from here doesn't mean you're going to get the entrapment site here. It could be anywhere along the continuum. Moving on. There we go. Right, so common entrapment sites. As I mentioned earlier, first is the nerve root exit, starting from the neck joint itself. And linking to what Thulasi said, if you've got a neck stiffness or neck segment that doesn't move, that's going to pinch onto your nerve. If you have a neck segment that moves too much, unstable joint or hypermobility, that joint, whenever you turn a little bit movement, is going to pinch onto your nerve, giving shoulder pain or giving hand numbness. Next, you have the interscalene muscle, which is basically a fancy way of saying the area between your scalene muscle at the side of your neck. If you use your neck too much, the muscles become tense, it can compress, pin against the nerve, giving you your symptoms also. And the last point before the brachial plexus exits and it divides into the different branches is the chest region here. So the pecs and the coraco. Right there, if you've got a lot of tight chest muscles, it causes a lot of crowding and therefore can compress the nerve also. Now, why do you need to know these common entrapment sites? Because here is where it relates to your work postures and it becomes relevant for you. Looking at this picture of my colleague here, she doesn't actually sit like that for the record, it's just a model. You can see from the head, Thulasi already touched on the forward neck posture. With these postures here, if your neck is not in an optimal alignment or in an optimal movement pattern, it's going to be potential for nerve entrapment right there in the neck. Moving down to the shoulders, if you're slouched or if you're rounded, the chest muscles here get a bit tight and they're going to cause some nerve compression here, just before it exits into the shoulder. So people always say, I've got tightness in the armpit region, numbness here. It could be related to this posture, tightness of the shoulder muscles and chest muscles. And last one, arms not supported. If your setup is in a way where your hands are having to constantly elevate to your keyboard here, like a T-Rex, rather than resting here, the ideal position should be a 90-90, nice, relaxed, comfortable position. Eye, visual level of your screen, same level with your eye. That's the ideal position. If not, you're going to be holding up here, and these neck muscles are going to be going through a lot of tension throughout the entire time you're doing your work. Okay, now nerve entrapment signs. In the early stages, you wouldn't know it's an entrapment because it can present itself in shoulder stiffness or neck stiffness and just reduce mobility. What can really help it is not nerve conduction tests, or what can really diagnose it is not nerve conduction tests. Although people think, oh, nerve, I should get it scanned, I should see a neurologist, I should get something to test my nerves. Fun fact, it doesn't actually show up positive on the nerve conduction test because it is only an issue with the wiring of your nerves, the outer layer, the inner layer, when it shows up positive on nerve conduction test. With a nerve tension, generally impulses still can pass by within the nerve. Therefore, it will still light up on your test. But what can really tell you you've got an obstruction, you've got an entrapment, is where movement specialist expertise comes along, where physios comes along to say, we're going to test your nerve tension. And that means placing the nerve, provocating the nerve in different positions that tenses the nerve, stresses the nerve, or compresses the nerve. Then we can see and we pinpoint, okay, this position here stresses this part of the hand. Why? And then we relate back to our anatomy knowledge and say, okay, it's coming from here, it's coming from the elbow. And if you really want to confirm it, diagnostic ultrasound will do a fantastic job at picking up where the entrapment sites are. Now we're going to go through a practical where you are going to experience firsthand provocating your nerve. Okay, it's one way to assess for nerve tension. So bear in mind, it's only a provocation test, and it's meant to generate tension by altering one part of the entire nerve pathway. So your entire road system, we're going to change one part. So let's start off with your hand reached out this way. So nice and relaxed here. Okay. Next, what I want you to do, your wrist is going to turn all the way down. So some of you may already notice, oh, I've got some forearm here. It could be related to forearm tightness. Okay, it could just be your muscles here. Now, what I want you to do is tilt your neck away towards the opposite side. And some people may feel, oh, now the tightness really increases. I'm feeling a strain in my neck, or I'm feeling a strain in my shoulder, or a strain in my forearm. Now, release the wrist, or release the elbow in some people I see. So all the way here, tension up, pain. Release the wrist, and you'll find, that sort of relaxes. But I'm not changing anything on my arm. I'm only moving my wrist and moving my neck. So can you see how the entire system here, tensioning one end, can give you repercussions down the hand? And by offloading one end, it offloads the nerve. So some of you might feel, cannot this side. Let's try it on the other hand. So some people will feel a bit more tighter on the left or on the right, depending what arm dominant you are. And that's just an indication of the neural tension. Some of you might not feel anything because it's perfect pathways, perfect gliding and sliding of your nerves. But this is only one variation to test the nerve. And in fact, this is one of the methods we test for carpal tunnel, the nerve responsible for carpal tunnel. There are various positions we can test different nerves, putting your arm in different positions, biasing different components. And here is where we can pinpoint if you have numbness into the thumb is a very different nerve compared to the numbness in the fingers, because different nerves supply different areas of the hand, or different areas of the elbow, different areas of your shoulder. And this is where nerve tension can sort of bias and find out where that entrapment site is. What can you do to help yourself if you have a nerve tension or if you feel numbness in your hands after sitting for long? First things first, ergonomics. Protect your nerve. If you're constantly in positions that stresses or compresses the nerve, then that's where the nerve's going to get irritated. You're going to get numbness in your hands. So change your setup. But if you've changed your setup and you're still having these issues, likely you have some obstructions going on there. What you need to do next is to perform some nerve glides. What I just showed you is one of the ways to glide your nerves. So I tension up my nerve here, I offload my nerve. So what I'm actually doing is sliding through my nerve through the pathways. Can you help me, Floss? So I'm going here and we're sliding away. The nerve is actually traveling, and that's where you ensure mobility of the nerve. Because when a nerve is irritated, you want to keep it moving. You want to reduce the swelling. And if that doesn't help, we also generally recommend nerve supplements or vitamin B or B complex systems to help nourish and stimulate some nerve healing. All right. And if the simple nerve glides aren't helping you, what can a physio do for you? Here is where we are a little bit more specific in what nerve glides to prescribe. I've given you a general one just by moving the arm. But if you have an entrapment in the elbow, it's our job to find out where it is. Perhaps your nerve floss could be just flossing the elbow. Perhaps it's just something as simple as rotating the elbow, bending or straightening the elbow. Or if it's in the chest region, the nerve floss might not be here. The nerve floss might be here. So here is where the physio can find out nerve glides bias specific to your entrapment site. And if there's something really compressing onto the nerve, what we do is we decompress or we remove whatever the obstacle is. Could be tight muscles. And here again, people enjoy it, the massage part of it. Offloading the muscles that are tight, compressing onto the structures that's giving you your nerve irritation. And if your nerve is really, really irritated, that's when desensitization tools come along, and we use methods such as electrotherapy or TENS to sort of desensitize the nerve, allow you to feel a bit better, allow you to move. Because the often thing that happens is people are scared to move because of pain. But if you're desensitized with some electrotherapy, you're a bit more okay to move, and that will allow you to do your nerve glides and floss the nerve and ensuring its mobility.
Okay, so now that we have spoken about nerves, we have spoken about muscles, we have spoken about ligaments and the joint itself, here's some of the lesser known cause that could potentially cause your aches and pains. So the first one is a very common thing, stress. So increase in cortisol level in your body when you stress, it makes you a bit more sensitive to pain. That said, it could be the same amount of pain that you're feeling on a day-to-day basis, but on the day that you're a bit more stressed, you do tend to feel it a little bit more. That's because our body generally becomes a bit more sensitive when your cortisol level increases. The second thing, not enough sleep. Again, same. Not enough sleep, it will heighten the perception of pain. It could be the same thing that you're doing every day, but on the days that you're a bit more tired and on the days that you didn't get enough sleep, you will realize that you are a little bit more sore. You get sore very easily, you get pains and aches very easily. You tend to feel, oh, my joint feels very stiff today, very easily. That's all because that's how our brain and our body is. It's not enough rest. And lastly, it's diet and lifestyle. So diet and lifestyle, because of the types of acid and saturated fat that we have on our day-to-day meal, it usually are a building blockers for body's inflammatory response. That means some of the food, they are very highly inflammation prone. So that means when the inflammation increases in your joints and in your muscles and whatnot, right? Inflammation sends out receptors of pain. Hence, you feel a bit more achy. So some people, we do have patients who come in and say, oh, I have a bruising kind of feeling at the end of the day. That's because usually inflammation builds up and you start to feel that sort of sensation. So how do you know which one is an inflammation pain? Usually inflammation pain will be, if you put your back of your hand at that particular structure when it's painful, it's usually a bit more warm. You feel a bit more warm compared to the opposite side. So that's one of the signs of inflammation. And usually we will go against the beliefs of hot pack helps you to reduce the inflammation. We will do ice pack because warm, you put ice to cool yourself down so that the inflammation doesn't continue building up. Here's where heat pack is actually very bad for you. The more you heat it up, the more blood flow you get, it's going to inflame even more. So this is just a tips for you guys. So now that we have discussed about variables of how pains and symptoms can come in, we're going to look into something very simple. We're going to get you to feel something. We're going to get you to move and do something. So this is called a French lady. So basically what I want you guys to do is, all I need you to do, bring your ears to your shoulder and try the other side as well. See how you feel. So the most common thing that we will see is you can't keep your head straight when you tilt. Your head will tend to tilt and rotate. One side you'll be able to it doesn't go down, your shoulder will follow through. So what I want you guys to do is put your arms by your chair. So you're gonna hold your chair. You don't have a place to put your hands. And all I need you to do is I want you to tilt your head away while your spine goes across into the opposite direction. So I'm doing it on the left hand. So my left hand is holding onto the chair, nice and relaxed. And my spine is shifting to the left while my neck is going to the right. And come back to the middle. We'll do it 2 more times. Shift your spine to the left, tilt your neck to the right, and come back. One last one. Shift your spine to the left, tilt your head to the right, and come back. Now, sit back into your normal position. Try tilting your neck to the right and to the left. See how do you feel? Do you feel a difference in terms of just a small stretch? It's called a side bending stretch. It's called a French lady. So it's just a side bending stretch to give you a bit more mobility in the joints and the muscles to relax. And it's actually something that you guys can do after a long day at work. All right, so we are at the last part of our talk. So if you guys do want to know a bit more about us, you guys can come and find us at Regen. So we do have 2 branches. One is in Jayawan, one is in Menara Hub St. KL. So those people who are working in KL, you can actually very near. You guys can just drop by during lunchtime and whatnot. And here's our social medias and stuff. Or you can drop us a WhatsApp, and we will be able to get back to you with your appointments, or even just to answer your questions itself. So while we wait for that, we hope to see Q&As in the chat so that we can help you out.
Yep. Thanks so much, Thulasi and Chloe, for your explanation today. So to our guests who are with us here today, if you have any question, please put them in the chat box. We will proceed to answer the questions that were sent in with the registration form first. Okay. Because are you able to hear me clearly, Thulasi?
Yeah.
Chloe? Yes. Okay, great. Okay. So the first question that we have, from our attendees for today is, for those who have done carpal tunnel surgeries, is there a possibility that they may have to undergo the same surgery if they encounter the symptom later in their life?
Yes and no. So symptoms, like I said, symptoms will be coming from carpal tunnel is very specific to the tunnel here. So where the nerve gets compressed between some of the tendons that passes through the carpal tunnel. And if they experience the same symptoms, it could sometimes be just scarring because you've had something go in there. Things heal. It's almost like you graze your knee and you have this wound and a scab on your knee. That's what's happening when things heal. So the first thing after a surgery, normally you go through scar management. And if things aren't managed here, likely the nerve will be compressed again. Yes, in terms of you may have to go through it again if you really want to release and correct that again. Or secondly, nerve glides. So you've got some kink happening here. What you can do is a nerve glides in the wrist itself or the entire pathways, or releasing whatever the obstruction is, depending on where and what is compressing onto the nerve flow. So answering the question, yes and no.
Okay. I love the a few structures that you have shared just now with the nerve glide and also the French lady with tilting the head and the body. I think this is useful because sometimes we get so absorbed in sitting in the same position, that we forgot. And I think this simple stretch helped a lot. Okay, the next question that we have is about can the slip disc at the neck recur? Currently doing exercise to prevent pain.
Okay, so a slip disc in the neck, usually it depends on the slip itself. Yes, it can continue slipping forward. So usually the disc will either slip forward or slip backwards. The exercise can prevent you from getting that structure more and more compressed and then bulge even more forward. But if you continue to doing what caused it, then yes, the disc can slip forward. So exercise can only sometimes help you so much. But again, it depends on how much percentage of the disc itself already slipped forward.
Also, in regards to disc, they have this presentation where there is flare-ups. So you can have a presentation where your disc is absolutely fine, but with a history of a slip disc or herniated disc, there is a chance for it to reoccur again and give you symptoms again. Doesn't necessarily mean your disc is shifted or whatever. It's just the nature of disc injuries. It does come and give you pain again, and you just need to manage it. And that's how physio will teach you when you're having these symptoms. What do you do to stabilize your neck? What do you do to offload the disc? Whatever is compressing onto your disc that is giving you your pain source, that's where we can come and help you. But bear in mind that people will experience a recurrent of symptoms. So don't be afraid that, oh no, it's happened again. It's quite common actually in the back as well as in the neck.
That's right. I think having the right physio or the right exercise is important to ensure that you are targeting the right muscles, okay, or nerve.
Yep.
Next question we have is for trigger finger and trigger thumb. Why does it happen and what is the remedy?
Okay. So usually trigger finger and trigger thumb, right? It could be different sort of pain, different sort of sores. So it could be a tendon that's kinked, a tendon that is not moving very well. So tendons usually you will be able to move through, like how you can let go and come back. But sometimes they are either shortened, that's why you can close, but when you open, it doesn't let you go. It doesn't recoil back. So that could be one of the potential. Another one is usually nerve related. So imagine your nerve is entrapped somewhere and they supply all the way to your fingers. And when you grip, it feels a bit more tighter. It doesn't feel as smooth because something is just not letting you go. So a trigger finger and a trigger thumb, usually we would suggest you to get it tested out to see if it's coming from a tendon source or is it coming from a nerve source, because they have different sort of managements and stuff.
Okay, so it's important for a person with trigger finger, trigger thumb to know what's the source, right? Before treatment can be applied.
Prescribed,
okay.
yeah.
Next question, how to manage recurring neck and shoulder and hand numbness? I think you've covered that just now today. Okay, so today, because this all these questions came in before our talk for today. Okay, so next question we have is this attendee have mentioned, have numbness in finger after awakening in the morning and when ironing clothes. Left shoulder joint to hand movement is restricted, especially trying to scratch the back of the body. Interested to find out what to do on this, I think.
Right, so there's two things, right? One is numbness in the finger in the morning
Yes,
itself.
in the morning, and also
Okay,
when
ironing.
in that position, so also you know whether it's standing up or sitting down.
Correct, yes. So the one in the morning, I would be probably relating it to the neck or shoulder, whatever along here. Because when you're sleeping, it's basically a prolonged static posture. So if your neck is held here and you're compressing on the nerve, that's where your obstruction happens. And you wake up, you find somewhere along the path you're going to get the symptoms. Or ironing, if you're ironing this way and your shoulder is really having a lot of tension and just compressing onto that nerve, then you might have the same symptoms down the hand. But as soon as you put down and relax your shoulder from the ironing position, perhaps you might find it goes away. So then that will show me and indicate to me, okay, is it a neck joint stiffness, like what Thulasi said, when you're sleeping, you really just don't move, kinks onto the nerve, or a neck shoulder muscle that when you're working hard at it, compresses onto the nerve. So it could be an active structure or it could be a passive structure. So that was question one. I think there was another one, second part of the question, can't remember.
So the left shoulder joint to the hand movement is restricted, especially
left shoulder
scratch back of the body. So
correct. So
interested to find out what to do.
What to do? Okay, so number one, you need to get it checked first, because restrictions could come from either shoulder restrictions, or it could be a nerve tension. So like I said earlier, nerve tension normally, or nerve entrapment normally doesn't really present itself quite early on. It masks itself in a lot of stiffness and instability or hypomobility, because the nerve is irritated, muscles and around the structure wants to protect it. So it sort of guards it. And then you have this, I can't really move. So oftentimes we find when we floss the nerve and we floss the nerve around the shoulder region, and you're like, hey, I've got shoulder mobility back. Because all along, it may not necessarily be a shoulder problem. It could be very well a nerve-related problem that is guarding your shoulder. Having said that, it could also be a shoulder-related mobility issue, which is why this person, if you don't have the range to move your shoulder, certain muscles have to work harder, and then compressing into your nerve, giving your hand symptoms. So it's a bit hard to say what it is without assessing, but it could be a shoulder mobility, it could be a nerve tension mobility issue as well.
Okay. I have learned something new today, nerve flossing. You know, when you mentioned about, I think that's actually very good, because sometimes we have this tightness. I think it's good to do that stretching repeatedly a few times. But I think knowing what to do or how to do it, that's also important.
Correct, knowing the correct one for your specific issues. So what we've given you is generally a general one.
Yeah. So for those our guests who want to find out more, please visit Regen, who's you have the Instagram, WhatsApp, and also Facebook page to find out more and also to make appointment. Okay, moving on, we have a few questions. I hope you will touch on numbness of foot also. I have numbness on my sole of my right foot for about a year. The numbness has improved now. Only my right toes are numb when I do my morning walking exercise for an hour 4 times a week. I have no pain. Neurologist told me there's no treatment. Any remedy to remove my numbness of my toes?
Okay, so like I said earlier on, neurologists, if you check on a nerve conduction test, it might come out negative because there's nothing there. So numbness is a nerve symptom, clearly, but where it's being entrapped, it could come from the lumbar spine, it could come from your hip, it could come from your knee, it could come from the actual foot. So finding out the specific areas can help you offload whatever that's compressing on your nerve. Again, it could also really purely come from the foot mechanics itself, the bones and the structures of your foot, especially when you're walking, you compress on the nerve itself while you're walking, you offload it, it doesn't get the numbness. So various things can cause it, a bit hard to pinpoint, but the same thing with your hands, can start from the neck. For your feet, it comes from the back. Yeah. As a general rule of thumb, doesn't mean it has to come from the back, it can come from the hip and bypass the back. Yeah.
Okay. All right, I hope that answered the question for the foot numbness. The last question that we have in the registration form, what are the causes of numbness of the body and hands? So our guest speakers have explained that today. Okay, so now moving on to the questions in the chat box. Yes. So I'm actually scrolling up to just catch up on the questions that we have. First question that we have from the chat box is, I have undergone prolapsed disc in 2011. For the past 2 years, I have always find the tightness on both my necks, both necks. Okay, I am a retiree. Previously, I had the same complaints, but it was cause of too long too much working and staring into the computer. But now that I've retired, somehow this stiffness of my neck never reduced. What is the triggering factor in my case?
Okay, so like we explained before, usually a symptom of pain or a numbness or whatever not, right? It usually causes by something that is moving and something that is not working. So she said that she had the complaint before, but it's due to work and staring too much into the screen. So that already gives us an indication of some things are already working and some things are just underworking and not doing what it's supposed to do. So there's already some sort of muscle imbalances that's going. So now that she has retired, even though she is not doing the same movement, but that's how the muscles are. They never recover. They don't know how to use the opposite side. Hence, the stiffness in the neck itself is still there. So that means it could be a joint related, it could be a muscular related. These are your triggering factors because there is some sort of imbalances. Usually, we will recommend get it checked, see what is causing what. Once you retrain the side that is not moving very well, you should be much better.
Okay, so when you mentioned to get it checked to know what is causing the pain, right? How do you do it, or how does the patient do it?
Okay, so it will be a bit more harder for the patient itself because when you have a bit more guarding in your muscles itself, it's hard for you to determine what is causing it. Is it a joint or is it a muscle? So as for physio, we usually check active sort of movement versus passive sort of movement. So active movements will give us different potentials and passive movements will give us different potentials. So from there, we will then come to a conclusion of what is actually causing the treatment, causing the problem itself.
Okay,
basically
so
get it checked by a professional.
Professional, right? Okay, so
Yeah.
it means that come over to meet you to get assessed. Would that be able?
Yeah, or any other physio centers as well. It doesn't have to be us. Wherever's closer to your home, it's fine.
All right. Okay. So next question we have in the chat box is any medication to relieve numbness?
Okay,
please
to
recommend.
say that we are not allowed to recommend medications, but B-complex and like neurobions and stuff.
Yeah, so those are supplements.
Supplements that can help keep your nerve health. So it not necessarily will reduce your numbness, but it will keep your nerves healthy. But do get it checked. Why are you numb?
Yeah, I agree that vitamin B12 has been advised, okay, to take due to nerve, okay, for nerve. Next question we have is numbness on the left arm when arm is in a stationary position. Why and what can be done?
If it's a stationary position, usually it's because, okay, let's say I put my left hand down on the table for too long and I'm doing work. Again, it's like your nerve, you remember the nerve goes through a tunnel, you're compressing something. So that could potentially give you the numbness on the left hand. Or it could be, it's already entrapped on your neck, on your shoulder, either way. So you're not moving it for too long, it can't glide and slide. that potentially is one of the causes?
I think it also depends on what stationary positions. If I was resting my arm in a stationary position here, I'm bound to have some numbness. So I think it's good to check also what is the position and why only that position, or why even here. Then they'll tell me something. I'm not even doing anything. I'm just resting. So if you mean that stationary position, likely to do further up because your arm's not doing anything. So likely something further up the chain.
Because when numbness is mentioned, I always have imagine that the blood flow is not going on as much. So you have this pricky feeling. Yeah, like when you mentioned, you put a hand at a very high position, then you feel numbness on your hand, which is normal.
It's usually a nerve lah. So with like blood flow, it will be sensation. So it'll be colder.
Okay, all right. Next question. What exercises can help to release pain at wrist? Tendonitis at wrist.
Okay, so tendonitis is usually inflammation of the tendon itself. So our movements will be to give you that mobility through the range, but also not actually giving you inflammation. So that means we don't load you with too much of movement. We give you more isometric movement to help you keep that length and the strength of the tendons itself.
Okay.
Tendinitis, it's an inflammation, so do try icing.
Okay, ice. All right, to reduce the inflammation. Next
Yes.
question on tennis elbow. Causes and treatment. I guess the question is what the cause and treatment for tennis elbow and how to prevent from relapse of tennis elbow.
Okay, here's a very, very big topic actually. Tennis elbow is not very simple. So the first general main thing when we think of tennis elbow is actually tendinitis, tendinopathy we call it, which is irritation to the extensor tendons here. So you may not play tennis. Sometimes badminton players get it if you're doing a lot of drop shot nets kind of extension work because of an overuse of the extensor muscle groups. So that's one of the cause. It could be just an overuse where the tendons undergo a load more than its capacity, gets dysfunctional, hurts. Or tennis elbow can also be mimicking nerve entrapment around the elbow. So that could be a potential cause as well. And third cause could be just impact onto the joint or the tendons because you're not moving your other parts of the body, such as your shoulder. So if you're talking true tennis or true badminton, if you're going to go for a drop shot or whatever, and you're not using your body or you're not rotating through your arms, and you're just flicking through here, likely we want to look up the whole chain. Why are you loading here and not transferring force up into the body, transferring force elsewhere? So lots of different causes. Depending on the causes, only you can give you treatment. But rule of thumb, if it's a tendon issue, we need to load the tendon. It needs to go through progressive rehab because tendons do not heal by rest itself. Regardless of a tennis elbow tendon here, which is your extensor tendon, regardless of your shoulder tendons, tendons need to be rehabbed basically. So that's the treatment, is rehab. And what the specific rehab is, you have to come and see a physio.
So
how to prevent from relapse?
How to prevent, yes.
How to prevent? I'm talking more from a sports sense. If you're talking tennis elbow, you want to be making sure that the rest of your body is mobile. So you want to have good wrist mobility, good elbow mobility, good shoulder mobility, good thoracic rotational mobility. Okay, and secondly, you want to make sure that the capacities of your tendons are good. Because if I load it so high, but my tendons are super strong, this is nothing. But if I'm underused, for someone who never played for MCO 2 whole years, suddenly they go back to play, the load is here because your tendons haven't been used. So how to prevent? Make sure you're keeping up with your exercises, regardless if you're off season, on season, you're making sure the tendons are loaded progressively. Don't suddenly bombard them with excessive movements, excessive strength and weights. And number 2, looking at the rest of the body, the chain of how you transfer force. So that can be one of the ways to prevent it from relapsing.
Thank you so much, because I think those are very good advice on what to do, because many people after the open, right, they just went and did their major badminton and probably games. Yeah, and I think that's how injury happens. Okay, so next question we have, I have dislocated collarbone on my right side due to snatch teeth more than 10 years now. Having problem, my neck stiff go up to the head and to my leg. Is it due to nerve?
Stiff go up to the head. So neck stiffness up here, is it?
Yeah, I think neck stiffness and also to the leg.
So the head and the leg should be not related lah, because unlikely is related. Neck stiffness, is it due to nerve? could be and could not be. It could just be the joint itself also. Because if it's a trauma, because snatch teeth, I'm assuming it was a trauma, like you have a sudden tug, a sudden fall. So the neck could have been yanked into certain positions. So it could be a joint related, or it could be the joint causing the nerve to be pinched. Yeah, but generally stiffness condition is more not nervy. It's not a nerve presentation or stiffness.
Okay. So I guess the best way to get it assessed.
Yeah.
To find out more, then you know whether it's a tendon or a
also dislocated collarbone. So imagine if you dislocated here, is this moving functionally optimally again or not? Or is this stiffened up because it's dislocated? You've been held in a sling for so long, it's lost its capacity to move. Then when you don't have movements, you move other muscles, other structures to compensate, and then could potentially end up causing a nerve issue.
Yeah, I think physio and physio rehab is very, very important to ensure that your body back to the functional part. Okay, this question is similar to the earlier question that we have. I have numbness under my right foot near the last three toe. What's the cause? I think just now Thulasi mentioned that it could be due to the back. Is it from the back? Yeah.
Back or foot?
Yeah, maybe get it checked.
Okay, so we have a guest asking where's the outlet. Outlet is in Jayawan and also Menara Hap Sing at KL, right?
Yes.
Check out, yeah, website. Okay, find out about them. Next question I have is I have sharp shooting mouth pain that occur occasionally from top of the head to the eye. What is the possible cause? This is about headache, I think.
Yeah, I think this is about headache. So usually it comes from your eye muscles and your neck muscles. So it could potentially come from a neck muscle that is very, very tight, that is giving you some sort of tension build up in your head. Or it could be eye muscle that is very, very tight from looking into the screen for too long. Word of advice, get your eyes checked. And then probably from there, get your neck checked. Maybe some of the flossing might help, but potentially get a eye checked because it's coming from top of the head to the neck. So it's more eye-related condition.
Or it could be upper cervical spine because they do refer into the eye region. So the top part of your C1, 2, 3 region, not necessarily lower neck, but upper neck closer to the skull head region.
Okay, so get it assessed, then you will know what is the right problem, then you can have the right treatment. Okay, next question we have stiffness of the fingers upon waking up in the morning. Yeah, sometimes I feel that too. But after fingering exercise, I think stretching up, then only feeling better. What's the cause and treatment?
Okay, usually that is inflammation. So inflammation, okay, here's the thing about inflammation. Inflammation tends to build up during when you're in static position. So that means sitting or sleeping. You have been starting for some time. So the first movement you do to move, right, that's when you feel a bit more tightness because inflammation tends to build up, the joints are not moving, so there is like a lot of fluid around it. But when you move the first time, it feels a bit more stiff, it feels a bit more painful. But after like a few movements and joints related stuff, you'll be okay. So that's usually inflammation buildup. So you can either try ice, try anti-inflammatory kind of supplements. So we are looking at fish oil, ginger, turmeric, that sort of stuff. And it should help you relieve that stiffness that you're feeling.
Okay, so should I take some of the supplements, fish oil, okay, ginger? Yeah, because sometimes I feel that too when I wake up and I feel that it's stiff. Yeah. Okay, next question we have is what is the reason for soreness in the calves, foot and toes, which happens even at night during sleep? How to manage? So I can imagine that this person doesn't have soreness during the day, maybe at night. Okay, so how to manage this?
Okay, soreness, if it's coming something later in the day, right, it could potentially be a muscular structure that we're looking at. So I'm not sure what have you done throughout the day. If you have been on your foot throughout the day and at the end of the day, you get a bit more soreness into your lower half, that could potentially be why. How to manage it? Probably ice it or heat pack on it just to soften up everything and stretch it out before you sleep.
Okay, so heat pack and stretch out before you sleep. Is it advisable to do stretching or some people say do yoga, Pilates before you go to bed?
Yes, but do like yoga and Pilates can be very high functional. Do get a professional to help you. Following video, take it slow, don't push yourself. If you can't reach, you can't reach. Okay.
Yeah. Okay. Next question. What can help trigger finger and what cause it be like this? So I think it's similar to the question that you have
Yeah.
answered earlier. Yeah, maybe we can have a quick, maybe a repeat of just now what you mentioned.
Okay, so trigger finger, again, it could be potential from a nerve, it could potentially be from a tendon. Do get it checked by a professional to see which is which. What causes it? It could be an overuse of particular structure. So teachers do get trigger fingers, or people who type a lot, who do this a lot, they do get trigger fingers. So these are causing from overuse. So you can get it checked, and treatments can be as simple as just doing physios, just learning how to stretch. Yeah, just a finger glide.
So a quick one, a quick tip. I'm gonna teach you a finger glide to sort of mobilize the tendons in the fingers. So we're gonna do hands like that. You're gonna go into tabletop position. You're gonna go down, and you're gonna slide back up. So trigger finger, you've got two different tendons, one that goes all the way up here, one that enters halfway through. So you want to be basically sliding the different structures against each other. You're mobilizing, you're lubricating them between the tendon and the tendon sheath. So just sort of this wavy type flow movements, or do the reverse. Close down, open up, open up. So we call this finger tendon glides. So it just help to glide your tendons a bit better.
Oh, okay, this is very useful. All right. And at this point in time, your hand should supposed to be downward, right?
Yeah, so you keep it supported. Don't hold it here.
Oh, keep it supported. Okay.
But also bear in mind that if you're already having trigger finger, this might be difficult. But if you're having the early stages where you're feeling a bit stiff, but you're still able to get full range, this would be a good sort of gliding movements for your fingers.
Okay. So this is also good for those who wake up in the morning with,
absolutely. Yes. Yeah, motion is lotion. Keep it moving.
Okay, keep it moving. All right, next question. What to eat to reduce inflammation of tendinosis apart from cold compress? B12?
Anti-inflammatory sort of supplements and food. You can go more Mediterranean food. So you guys can Google that out. There's actually a lot of stuff that you guys can try.
Mediterranean type diet.
Yeah, it's more anti-inflammatory.
Like omega fish oils.
Yeah. Okay. So Google for Mediterranean food diet, that will help. Okay. Question: what to eat to reduce inflammation? Okay, sorry, this is just now what I've just now asked. Next question that we have is, okay, we actually have a lot of questions. We are going to end this at 4:15 because our speaker been with us since 3 o'clock. But if you have any question that's not reply, I'll get Chloe and also Thulasi to reply. I guess, would that be okay? Yes, maybe we'll pick up the last 3 questions because I'm just going according to first come first serve. Okay, that when we first come, they will answer first. Why fingers become numb after a week and when ironing lots of clothes? I think that was similar to the earlier question. Next question that we have is frozen shoulder a nerve problem, and what is the remedy? Frozen shoulder.
No, it is not a nerve problem. Frozen shoulder is a very general, vague thing to say. Your shoulder is stiff and it cannot move in its true range. So there can be a few reasons. The first main big reason is an adhesion of the capsule of your shoulder. So don't know if you want to put on the app, but basically our shoulder, if you think about it, simplistic terms, ball and socket joint, right? You have this structure called the capsule. Can you guys see the screen with the app?
Yes, I can see, but I'm not sure if our guests can see. So if our guests are not able to see, maybe you can put number 2 in the chat
so
box.
indicate whether or not you can see it or not.
Yeah.
Can see. Okay, good.
Yes, we have 2.
Cool. So generally, frozen shoulder, this one is the culprit. So if I take off all the structures, you've got your ball and you've got your socket. That's your shoulder joint, right? The ball and socket joint should be able to move quite freely. The shoulder is the most mobile joint in the body. But the main guy is this one here. So this, we call it your capsule. When your capsule gets stiffened and is a bit more tight, be it for whatever reason, swelling, chronic inflammation that glues everything together, that's when your joints have a little bit more trouble moving. So it's not a nerve problem, it's a soft tissue problem. It could be coming from this area here, or it could be coming from whatever ligaments that surround it, or structures and tendons that surround it that stops its mobility. So in short, no, it's not a nerve problem, it's a soft tissue problem.
Okay. And what is the
What
remedy?
is the
What do you
remedy?
suggest? Yes.
It's a hard one.
It's a hard one because
yeah, because there's a lot of factors involved. Mobility is number one, mobilization. So conservatively, physios can help you get there by stretching out the areas, by sort of, we call it mobilization, so giving you a bit more range and pushing it each time more and more. Or we're a bit biased here, but we do have an in-house orthopedic that does procedures to release frozen shoulders and sort of this adhesive capsule type syndrome, where what he does, he sticks a needle in and separates the layers and allow it to have a bit more room to move. So that in terms of a quick remedy, if you want pain is restricting you, yep, get it moving.
Okay. All right. Second last question that we have, do I continue to exercise if I feel muscle sore tightness at lumbar region? I have backache.
Okay, it's also a very vague question. So, okay, if the muscle sore and tightness at the lumbar region is coming from you loading and doing exercise, increase your protein, you should be okay. The soreness, you might have DOMS, but if it's something that has been there even before you started exercise, probably look into why you have a backache before continue doing that particular exercise that's causing you back pain.
Or it could be you're working the back muscles when the back muscles shouldn't be working. So we get a lot of gym goers doing lifting and you're meant to use your legs, but you end up having a back pain. So in that case, I would say no, because you're just reinforcing negative patterns. You're teaching the back to load when you're supposed to load the hips or the legs.
Okay. Back to the frozen shoulder, because the attendee put in a subsequent question. Treatment by correcting under GA or physio, which is better? That was the frozen shoulder.
Treatment correcting by GA or
physio, which is better?
Or under GA, as in like
under general
surgeries
anesthetic. Yeah, correct.
which is better?
Yeah, so
you're asking physios here.
So, yeah, I would also agree.
A bit biased kind of question. Depends how fast you want it. So physios are conservative treatment. We will get you there, but it will take a long time.
That's right. Okay, so last question of the day that we have. If you have any other questions, please feel free to make an appointment to meet the wonderful, friendly, so generous physio in Regen. Okay, what is the cause of muscle cramps on the legs?
Again, it's a very weak question. A lot of things can cause muscle cramps. It could be from a muscle that is overworking and it finally hit its capacity that it can't help you anymore. It could come from nerve. You just feel a crampy, spasmy kind of feeling.
Or sometimes quite simple as you lack of salt.
Yeah.
It could be a diet, issue.
Yeah.
Okay. So
Amy,
yes.
Before we leave, right? Can we share screen again?
Yep,
We have something for the attendees.
Yep, that'd be good. That'd be great. So for our attendees who didn't manage to get their question answered in the chat box, because I saw one or two, I will take note of your question, and then I will ask Chloe and Thulasi later.
Okay, so guys, before we let you guys go, what we have for you guys is so you guys can take a picture of this. We do have a free screening for everyone who attended today. So you will get a free consultation when you guys come in. So just show this to our front desk and you guys will get a free consultation for it.
Yeah, but you do need to make a booking for it right away.
So you can either WhatsApp or go through our online system. Do make a booking, come in, and yeah, we will help you guys out from there on.
Okay. Our team will also send this picture to all our attendees today. So
we will send it to you and then you can send it to them as well.
Yeah. Thank you so much, Thulasi and Chloe, for your time today. So this is a slide from me. For those who are asking for the address, I have the address here, which is ground floor, block A, Jaya 1. Just now, Chloe mentioned that Menara Hapsing is their another outlet. Okay, so also you can go to the website to find out about them. Okay, thank you so much once again for your wonderful sharing for today and taking the time on a Sunday afternoon, okay, to reply all the questions that we have. Okay, so for those who want to give your wonderful feedback to our physiotherapists today, please scan this feedback form, tell us what you feel about them, and also we will forward all the replies on their feedback to Regen Physio, to Thulasi.
Thank you so much.
Thank you so much, everyone.
Thanks for attending.
Thank
Thanks
you
for all
so
the
much.
questions.
So this is the website I Google online. Okay, Regen Physio and Sport Rehab. Okay, so you can check out who they are, facilities, book an appointment, contact them, follow their Facebook and also Instagram. Okay, so more information about them. Okay, they provide physiotherapy, and just now Chloe mentioned they have an in-house orthopedic. I think
Yes, we do.
Dr. Rajesh also came and shared in
Yep.
our talk before. That was actually last year. Okay, so it's a wonderful sharing, and we have learned so much. Today, we also have learned so much. My main learning today was about having this continuously movement and also nerve flossing. Okay, that's important. Okay, so the Pioneers Financial Services are our Prudential. So Prudential last week, hot from the oven, they have launched the precision medicine cutting edge cancer treatment that's tailored for all clients' needs. So if you'd like to find out more, please reach out to any of our friendly wealth planner from the Pioneers so that we can give you more information. So some may ask, what is a cancer precision medicine? So it's a form of medical care using genomic testing to select the treatments that is right for you. Okay, so you can go to the website to find out more or reach out to any of us. So our next talk, okay, this is our registration form. The topic is how should I respond to emergency situations by Dr. Wilmar of Gleneagles Hospital, Kuala Lumpur. So this talk was actually supposed to be held in last month in May, but due to unforeseen circumstances, Dr. Wilmar couldn't make it. Okay, so please register. It will be either on 10th or 24th of July. Our monthly talk has always been Sunday, 3 o'clock. This has been going on since we started in March 2020. So it's been 2.5 years now, 2 years plus. Thank you so much to all our attendees who have been continuously supporting us. I think we have formed like a community where I'm sure our speakers will realize that the questions will just keep coming in. Okay, and it's always been very active, and has been a great pleasure of mine to host and facilitate these talks for the past 2 years. Okay, so this is me. My name is Amy. Scan to get connected with Facebook, Instagram, LinkedIn, okay, or I can always email to us and check out our websites. And this is the team. Our team, the Pioneers Financial Services, the team that took care of everyone to make sure that you have got your Zoom link in, okay, and also able to keep in touch with us, okay. So this is us. We have a Facebook page. Okay, and we're expanding. So if you yourself or you know anyone who would like to join our team in financial planning, reach out to us to find out more, because in the past 2 years, even though during the pandemic, we have managed to help many families to get protected and to reach their financial planning. Okay, so our YouTube channel. So if you have missed out any of the talks, please feel free, or you came in late for today's talk, which we will upload later into the YouTube channel. So yeah, Chloe and Thulasi, you will be in YouTube. Okay, then yeah, just hop on to re-watch the video. Okay, and then subscribe and like. Right, so that's the end for today. Thank you so much, everyone, for a wonderful Sunday afternoon, fantastic learning. Our feedback form and our next health talk QR code is here. If you cannot scan them, no worries. Our team will send to you via email and also WhatsApp, so that register early, so that you don't miss the next talk. Okay, thank you so much. Have a wonderful rest of a Sunday and the rest of the month. Thank you. Thanks, everyone.